Hello again. An interesting study that I came across, and as you know, I always try to bring in newer information, something interesting, something that is not commonly seen. So this one was very interesting to me because it was a retrospective analysis of prescription data study. So in a way, it is not the most accurate way of predicting anything, but this particular study is related to dementia, developmental Alzheimer's disease, which also has cognitive dysfunction and memory lapse. The question is, does use of Viagra or Cialis or Levitra, the erectile dysfunction drugs, reduce the risk of developing Alzheimer's disease? One might say, why would you question the relationship like that? I mean, could you just even relate, say, having more number of cars or more number of TV and development of dementia? One is just a correlation, not coexistence. Those two things are different. So the drugs like Viagra, Cialis, Levitra, which are used for erectile dysfunction, are vasodilators to some extent. They reduce the blood pressure in the lung. They are completely approved for pulmonary hypertension or blood pressure increase in lungs. But they are also used for erectile dysfunction. So could there be an effect that reducing the pressure or dilating the blood vessels would improve the blood circulation and improve the memory, cognitive function, and delay the development of Alzheimer's disease? The study had a large population, and it is very interesting because these kind of studies are done about the prescription writings. So the study was included between 20 to 2017. I think after 2017, over-the-counter prescriptions for Viagra were allowed, and subsequently they were not included in the study as we don't know the reliability of non-users. So the study had people who were more than 40 years of age, prescriptions written between period of 2000 to 2017 were included in this particular study. There were a total of 269,725 patients, and they were followed. The mean follow-up was, I think, 5 or 6 years, 5.1 year. Lowest was 2.9 years, and highest was 8.9 years. So definitely close to about 3 years minimum. 5.1 year was the mean. And during that period, approximately 1,119 men, and women were of course not in this particular study, developed Alzheimer's disease. The question is, we have seen that in mice, the use of sildenafil and I think also of Cialis reduces the amyloid plaques and improves the memory in mice. So it is not totally unexpected that the study was carried out to find the correlations between using. It was very interesting results were found out. Again, this is not a conclusive study, though at this particular time it is. And I want to caution that there are couple of other studies. One was NIH studies called DREAM, and there was another one studies published in US. Both of these kind of defeated or said that there is no correlation. So the jury is still out. But to give you some details on this study is that they looked at people who used the Viagra based on their prescription refills. So those who had more than 20 prescriptions filled, then the second group was 21 to 50 and more than 50. And they of course found out that those who have filled in the prescriptions had reduced risk of developing Alzheimer's disease than people who had never filled in a prescriptions for these kind of drugs. Very interesting to me because the risk was 8.1 per 10,000 person year use in patients who had used the drugs, Viagra or Cialis, Cialis, versus 9.7 for 10,000, again, person year use in patients who have not used the drugs. So definitely there was a reduction. Those people who were more than 70 years of age had a better chance of reducing Alzheimer's. Again, the question is, younger people may not develop that early. They also had association with high blood pressure, diabetes. Again, both these diseases cause atherosclerosis and vascular dysfunction or vascular constriction. So these people had a reduction of developing Alzheimer's disease much more than people who did not have hypertension or high blood pressure and diabetes. So interesting part is that older people with associated high blood pressure and diabetes had a better risk reduction than people who were younger or who had no high blood pressure or diabetes. And as I mentioned before, people who refilled the prescriptions more often had a better response. The one interesting fact is that all these drugs do cross blood-brain barrier. Just to understand what is blood-brain barrier is, when we ingest a pill, it goes through stomach, intestine, and into the blood. Some drugs are absorbed quickly, some are not absorbed quickly. Some spike delayed, some don't spike, take early spike. And once they go in the blood, they seem to reach various organs. I mean, very simple example would be antibiotics. If you take a pill of antibiotic, it not only goes to your lungs and affects the bronchitis or pneumonia, throat if you have pharyngitis, it goes to your urine, urinary tract or the kidneys and excreted so that it affects the kidney, urinary infection. As you can imagine, every organ is involved when you take a pill because the blood goes to every organ. The brain is special. So some drugs concentrate better in lung tissue or secretions in bronchial tube. Some concentrate better in urine, so they're better for urinary tract infection. And some do not cross to go in the brain to help the infection in the brain. So the drugs have different ability to cross the barrier between the blood and the brain. This particular thing is called blood-brain barrier. So all the drugs that we take do not reach blood, but almost all the drugs that we take will reach every other organ, more or less. So some drugs will go or get concentrated in the urine better than others. Some go in more in the lung and bronchial secretions than others. But almost all the drugs will go to different organs because it's ultimately the blood goes to every organ. The brain is special. So this blood-brain barrier, as it is called, is better penetrated by Viagra or sildenafil than by Cialis or Levitra. An interesting fact. So theoretically, the Viagra should be a better drug than Cialis or Levitra. Again, there is no proof. I'm just telling you what could be thought of or what could be a consideration in the future studies. So just to summarize, this was a retrospective analysis of prescription refilled. A large study, mean age was 58.5, mean follow-up was about 5.1 year. When it was done by older people, 70 plus, associated high blood pressure and diabetes, they seem to have better benefits. Maybe sildenafil is better than Cialis or Levitra, not sure. Further studies are required. Essentially, more prescriptions seem to be better reduction for Alzheimer's. Now again, as I said, if you're older, you may already have some disease and a risk may be reduced quickly. If you're younger and you're going to develop it at age 70, this may not develop till you do the follow-up between, say, 55 to 62. Again, more studies are required. Thank you for watching. I hope these are interesting to you. Please send a comment and subscribe if you like it. Have a nice day.